welcome back to my channel. So while I was away, I found out a couple of things that I knew I was going to talk about on this channel. And one of them is actually the fact that people mix up the roles of healthcare assistants with care assistants. So stick to this video, stick with me while I explain the difference to you. A lot of people are not qualified to be healthcare assistants. They are only qualified to be care assistants or carers. So if you have been applying for the job of healthcare assistant while you're not qualified, you won't be surprised that a lot of no, sorry, we are unable to process your application further are coming your way. So I'm going to explain the difference to you, and then it'll help you, hopefully, it'll help you in your next job search. So stick with me. Let's go. Welcome back, guys. To start with, as a way of introduction, healthcare assistants and care assistants, like I said earlier, are two different things. They are two different job roles. One of them, you need qualifications to work there, to work in that role, while the other one, you can transfer your skills, both formal and informal skills, to work in the role. So a lot of Africans have had to come into the UK and work in the care sector because, first, it's the most readily available jobs around. Secondly, also the fact that that job is on the shortage occupational list. Either they come with their spouses, or they just find an opportunity to come into the UK via the health and care visa, and this has made a lot of people work in care. While that might not be their first choice of jobs, because of course you see bankers, professors, even medical doctors who have had to work in care because they can't just automatically come into the UK and start working in their various professions. In fact, some professions are deemed as non-transferable. So, for instance, if you're working in banking, unless you go into the IT sector, I doubt if you can come here and start working in banking. So these jobs are a little bit scarce, the jobs that we do back home. So in the UK, the most readily available job for everybody is the care work. And that's why you see a lot of people, once they get in, the first thing is to start applying for care jobs and all that, which is fine, but you might have been applying for a different role other than what you're qualified for. Healthcare assistants are different from care assistants. That's what this video is all about. So stick with me and I'll tell you the differences. The basic difference, so that we don't make this too long, the basic difference between a care assistant and healthcare assistant is the fact that a care assistant help people, patients or residents, help them to perform their activities of daily living, basically. So their job is to assist people, young, old, admitted into the community, in the care homes, wherever. Their job is to assist them to perform their activity of daily living. What are the activities of daily living? Basically, personal care, feeding, dressing, oral care, manual handling, that's mobility, and transferring them safely, and so on and so forth. Care of their skin, and so on and so forth. So basically, a carer provides support and assistance with all these activities of daily living. Carer might be working in a care home. A carer might be working in the community. A carer might be visiting the residents or the patients or the people at home. You know, someone who has limited mobility would need a carer to come in, support them to move safely, support them to do things, you know, things like that. So a carer might go into the homes to work. Those are carers, and that job is in abundance in the UK. We all know that. It's everywhere. You see, indeed, carer, carer, carer. Though sometimes some employers may use the title healthcare assistant instead of carers, but they are two different things. So that's basically the job of a carer. The qualifications for a carer is, it can be formal. Basically, you should have your GCSE level education. And I know a lot of my African people have masters, PhD, so we are overqualified. if there's a word like that, of course there is. So we are overqualified for the role of care assistants. So basically what I'm saying is that you must have at least GCSE level of education, and then you'll be required to have some other formal trainings, you know, like certifications, you know, going online and doing some certifications and all that, you know, to like familiarize yourself with how care works and all that. But guess what? Not all employer would require those certifications. Some will just say, come, we'll train you. And that they do, such that within 3 months, you know everything that is being done and the right way you're supposed to do them. So it's really that easy to be a care assistant. I'm not saying the job is easy. I'm just saying to become one, it's not deep. It's an easy thing to be. So the qualifications are not that, they're not that high. And when you're talking about experience, almost every African have experiences in caring. In fact, you know that your great aunt, that's your grandmother who lived with you before she died, the fact that you were helping her to eat, to drink, to, you know, to move safely, personal care, taking care of her, taking her to the hospital, bringing her back home, giving her her medications, helping her to restock and refill her medication. You see, these things, these roles, these are the things they ask you. During interview, we are still going to do a video on the interview questions and how to answer them. But for the purpose of this video, I want you to know that most of us have the experience that you need, the transferable experience that you need to work in care. That's basically, it's really not more than that. So that's the job of a care assistant. So people can either say they can either call them care assistants or carers. You know, that's basically their job. But healthcare assistants, on the other hand, they perform more clinical roles. Their jobs are basically either in the hospitals or GP practice. Those are the two places where you find healthcare assistants. In fact, you may think they are nurses. So it takes someone who actually works within the hospital system to know that, oh, this person is a healthcare assistant, this person is not a nurse. So because their jobs are more clinical, their jobs are basically to help nurses and clinicians to complete tasks that they are supposed to do. I'm talking tasks like phlebotomy. That's when you are taking blood from people, you know, IV phlebotomy. For those who are competent at it, they do it in the hospitals. Air syringing, you know, people who wash your ears. Yes, care assistants who are competent, they carry out those roles. So their jobs are to help nurses. Like a nurse has, for instance, maybe there's a 10-bedded unit, and the nurse has A, B, C, D, E, and F to do within a stipulated period of time. A trained healthcare assistant would be delegated some of those roles. So the nurse would delegate some of those roles to the care assistant, to the healthcare assistants rather. So the healthcare assistant will take care of those aspects under the supervision of the nurse. For instance, you want to take bloods for this test, and that test. The healthcare assistants who are trained will take the blood from the patient. GP practices, you find the healthcare assistants there taking blood from people, taking samples, urine samples, and doing swabs and all that. Even wound dressing, you find healthcare assistants doing them. So that's the difference between healthcare assistants and care assistants. Healthcare assistant is a more specialized role. In fact, I would take you to, I want to show you, or at least I won't be showing you my screen, but I want to read out to you the qualifications, education and training requirements, of a healthcare assistant. So for the healthcare assistant, you have to, it says here, routine clinical care. That is, you're monitoring and recording vital signs, the TPR, BP, SAT. A healthcare assistant will be trained in doing that and to know how to, monitor them and document them appropriately. That's the job of a healthcare assistant. Assisting with medical procedures, like I just explained to you, like phlebotomy, healthcare assistants do that because for those who are trained, in fact, most of them at that level are required to be trained for those. If you are not trained, the hospital will train you and then you start carrying out the procedures. So collecting samples, like I said earlier, cleaning and dressing of wound. So it's not nurses that have to be dressing wounds all the time. In fact, most of the time, when nurses are busy doing other things, healthcare assistants do wound dressing and they have to follow the aseptic procedure and, so it's a really specialized role. And then conducting health education, talking to people about their health, knowing what to say, the right way to say it, the right information. So healthcare assistants are trained to conduct health education. And these are some of the roles. This says, for a healthcare assistant, you can do a college course. Those are the NVQs. They call them NVQ is a National Vocational Qualifications. So NVQ have different levels like level 1, 2, 3. So, they expect you to have one of those NVQ courses. Then they say for entry requirement, that's the entry level healthcare assistant, you're expected to have your GCSE or equivalent, then a level 2 course, that's the NVQ2, which basically you can do in a college. This is the NHS website, and it talks about the healthcare assistant role. So it says the role summary is to support the practice nursing team in the delivery of nursing services. So, like I explained earlier, it's to support nurses in the delivery of, of nursing services. And then, to support the clinical staff in provision of treatment, prevention, health promotion, patient education, and all that. So, in fact, the primary responsibilities here, there are so many, like, you can't even, for someone who was a banker back home, and then you want to come here and become a healthcare assistant, you need training. In fact, you need training. It's basically a role for people who are already healthcare people, and then they haven't been able to get into their preferred job positions. So it says a lot. Here it says undertake new patient health checks, support practice nurse with health promotional programs, carry out baseline observation, we already spoke about that, facilitate routine or 24-hour BP monitoring and advising patients accordingly. That means they must know, they must be able to monitor the patient's BP, they must be able to advise the patient on the implications of their BP, what they should do, what they should not do. So can you see that is a more specialized role? It also says undertake wound care, dressings and other clinical tasks as required, support the practice nurse with management of chronic disease clinics. Imagine chronic disease clinic, that's the diabetic clinic, hypertensive clinic, you know, cancer, all these chronic diseases. The care assistant will support the nurse in managing the clinics. So carry out BMI checks. When trained, administer flu vaccinations. So that means they can even give vaccinations. Ensure specimens are recorded, so proper recording and all that. So those are the primary responsibilities according to the NHS. Secondary responsibilities, it says when trained. That means they can take you without knowing or without having these skills, but you must get trained. Now it's saying when trained, you have to be able to undertake venipuncture. When trained, you have to be able to carry out air irrigation, carry out ECGs. Imagine ECGs. So it's a lot of responsibilities for them. Now they are saying role specifications. So for healthcare assistants, you must have healthcare qualification or equivalent level. Can you see? The NHS says you must have healthcare qualification or equivalent. Then it now says phlebotomy, air syringing. Those are not essential, but they are desirable. So that means if 10 people are applying for the job and you can do phlebotomy, you have the certification, for ear syringing, then you have an edge over the people who are also applying for that same role. And then talks about the experience. Okay, experience, you must have worked in a primary care environment for 2 years. Now it says clinical knowledge and skills. Essential, what you must know how to do. It says immunization. So here the NHS says you must be knowledgeable and be able to carry out immunization, flu, B12, childhood immunization, travel immunization. You must be able to do that as a healthcare assistant. It says treatment of small injuries, so you must be able to, once you see an injury, you must know what to do. You must know what to do, what to apply and all that. And then dressings, you must be able to do wound care, removal of sutures and staples. You must be able to do that. So those are essential things that they are not going to waive if you want to become a healthcare assistant. That's the NHS. But it says it is desirable for you to have wound care knowledge, ECG, venipuncture, height, weight, BP, spirometry, ability to record and to record accurately on clinical notes. So basically, these are the things you need to know to do as a healthcare assistant. Now, it says general skills. You must be excellent in communication, both written and oral. You must have strong IT skills. I trust my people, we have that one. You must be clear, polite, You must be competent in the use of the management, the patient record management system. It's computerized now in the NHS. So you must have good interpersonal skills, ability to follow clinical policy and procedures, blah, blah, blah. Having said that, so I would like you to know, in conclusion, that there's a big difference between healthcare assistants and care assistant. I'm sure with all I've said, you will agree with me that there are two different roles. Maybe that's why you've been applying for the wrong role. Once you see healthcare assistant role, you apply. But it takes a whole, they look at your CV and they're like, oh, what does it think? Banking 10 years, teaching 3 years. How is that enough? Or how is that good enough for the role of the healthcare assistant? So when you are looking for a job, when you are searching for jobs, make sure you look at the appropriate role that you have qualifications for. Care assistant does not really need a lot of formal qualifications. All you need to do is think well on how you will take care of this person who do not have or who have lost the ability to do this. And then go for your certifications. Those certifications are important because they will give you a prior knowledge of what happens in the homes. It's not as if the first time you enter a home is the first exposure you will have, to care and all that. No, that could be embarrassing. Actually, that happened with one person who also came from Africa, and the person was posted. The person came through an agency, and he was posted to my unit. I really, really needed to. I had to be supporting. I had to make sure I was following him back to back, because you know how the local carers can be. Oh, this agency staff, they don't know anything, blah, blah, blah. And then one day I had to tell them, see guys, we don't have all this back home in Africa. Most of these people you see working here, who are students, who are working in care, they have heads of their different departments, heads of their different parastatals. And so you really can't blame us. Teach them what to do. We are very fast learners. So, I've had to be doing that a lot during my practice. So, guys, those certifications will help you. And that would lead me to the next video. Next video, I'll tell you the courses to do. If you are someone who has never been into health, you know nothing about health, don't worry, I've got you. In my next video, I'll tell you the courses to do. I'll tell you where to do the courses for free. And if what you want to do is not available on that website, then there are other places where you can do the courses and just pay a token, not a lot of money for the certificate, because the certificate will really help you. So that's what's going to happen in my next video. Meanwhile, I need you all to please subscribe to my channel. See, if you don't subscribe, how are we going to become a family? How are we going to become a big and large family? It's important to me that you become a part of my YouTube family so that we can interact. You can ask me questions, I can answer the questions, and we can just relate. So please subscribe to my channel. Let's grow the channel together. Subscribe to my channel, like my videos, and what's the last thing? And keep coming back. Please subscribe and like, and then put on your notification. That's also very important. Please put on the notification so that when I drop a new video, you will just know instantly, and then you can talk with me, you can ask questions, you can interact. That's very, very important to me. Thank you very much. Thank you guys for subscribing, for liking, for putting on your notifications for this channel. Thank you very much. I appreciate you guys. See you in the next video. Thank you for watching. Bye.